Welcome back to my channel, and in today's video we are going to discover about the quadriceps muscle. We are going to discover the biomechanics and pathomechanics of the quadriceps muscle. And quadriceps is quite a general known term to all of us, and we know the origin, insertion, nerve supply, action and almost everything about the quadriceps muscle. But today here we are going to have a strategy, that is, we understand the quadriceps muscle, we understand the orientation of different fibers in the quadriceps muscle, we understand the role of patella in quadriceps muscle function, we understand the role of quadriceps in strengthening or loading your ACL ligament, and we understand the role of quadriceps in gait and posture maintenance. And finally, we discover the difference in weight bearing and non-weight bearing strengthening of the quadriceps muscle. This is going to be an extensive research and discussion, but we'll do it in the more simplified manner. Again, if you like to know one thing in particular, the time codes are given below. And this is Tony's tutorial, and we discuss today the biomechanics and pathomechanics of quadriceps. Yes, the biomechanics and pathomechanics of quadriceps muscle or the knee extensors. And you know which are the knee extensors? That's your quads. Yes, right? That is the rectus femoris, vastus medialis, vastus lateralis and vastus intermedius. The four muscles are making up your knee extensors. I'm not going to detail about the anatomy of that because it's quite known to us. If anybody has any doubt in it, we have a video in our channel discussing about the anatomy of this muscle. You just have to look about that, right? Yes, and in this we have a peculiarity. The rectus femoris is the only two joint muscle. We need to know about the biomechanics, and rectus femoris is the only two joint muscle. It is arising from the anterior inferior iliac spine and to the tibia or the patellar tendon or patella, right? Yes, that is the rectus femoris is the only two joint muscle. You just have to remember that. And all these muscles from their origin attaches to the base of the patella and sides of the patella like this, and finally becomes a common tendon known as the quadriceps tendon, which is quite known to us. Yes, right? And this tendon passes the patella and insert into the tibial tuberosity as the patellar tendon. So the quadriceps tendon becomes the patellar tendon or the patellar ligaments. That's something that you have to remember. Again, once again, all this muscle insert in the base and sides of the patella, but at that side there becomes a common tendon. The common tendon is known as the quadriceps tendon, and that common tendon continues past the patella to become the patellar tendon, and finally that insert into the tibia. And the common function served by all these muscles are purely known to us, that is the knee extension. These are chief knee extensors. But now we have some differences. We see that the fibers or all these four muscles in the quadriceps are arranged in different direction, and their line of pull is completely different from each of this muscle. Even though they are known by the quads, the four muscles, their line of pull is different from each other, and let us discover that. For example, if we have a knee joint over here, right, good, and you have a patella over here, and in center you have the rectus femoris, and associated with that you have the vastus medialis muscle, right? The line of pull of this muscle is this one, okay? And now you have your vastus medialis muscle in this direction. The line of pull of vastus medialis is this, yes? And now you have the vastus lateralis muscle. The line of pull of the lateralis muscle is this one. See what? The difference, this is laterally oriented, this is medially oriented, and this is almost to the center. And only vastus medialis, vastus intermedius is exactly having the line parallel to the long axis of the femur. And thus this is the purest knee extensor. This is the purest knee extensor. Which one? The vastus intermedius muscle. Why? Because the line of pull of this muscle is exactly in direction with the long axis of the femur, and thus it acts as a purest knee extensor. The studies shows that The vastus medialis muscle is oriented about 40 degree from the midline. The vastus medialis is oriented about 40 degree from the long axis of the femur or the midline, right? More correctly, long axis of the femur, because the femur is slightly oblique. You remember that? Yes. And the vastus lateralis muscle is about 35 degree from the midline or the long axis of the femur. So we see that all this muscle serves the common function as the knee extension. But the line of pull of this muscle is having some lateral component and the medial components. The line of pull of the vastus lateralis is 35 degree away from the long axis of the femur, and the line of pull of vastus medialis is about 40 degree away from the midline of the femur or long axis, that is 40 degree to the medial direction. Right? Yes. And the purest knee extensor is the vastus intermedius because its line is parallel to the long axis of the femur. Yes. Now we have one more peculiarity. The vastus medialis muscle is having an upper fibers which are more longitudinal in direction, like this, and lower fiber which are completely oblique. And thus we differentiate this muscle into two fibers, the upper and lower fibers. The upper fiber is known as, you know that, yes, very good, come on, vastus medialis longus, yes, VML, vastus medialis longus, and the lower fiber is known as vastus medialis obliquus. Yes, VMO. We have heard about this a lot, especially in related to patellofemoral pain or patella and etc., which will be discussed later. Yes, the vastus medialis muscle is having two fibers. More correctly, their orientation is different. One is longitudinal and another is oblique. Therefore, we call them vastus medialis longus and vastus medialis oblique. That is the VMO and VML. This in particular has an orientation of 15 to 18 degree from the medially. That is 15 to 18 degree medially. And what about the orientation of VML? Any guess? Yes, that is 50 to 55 degree medially. 50 to 55 degree medially. Yes, and this has some clinical implications. We see that the VMO in particular, or the vastus medialis muscle, has a great role in medial stabilization of the patella. It is able to pull the patella medially and stabilize the patella. And thus this comes into extensive research in present scenario, and many clinicians try to strengthen the VMO in particular and to stabilize or get more stabilization for the patella. But researchers are contradictory into that. So researchers says that this is the same fibers of a same muscle innervated by the femoral nerve itself. And it is tough to isolately strengthen the VMO in particular, but some researchers suggest that you can strengthen the VMO. So in patellofemoral pain or in patellar problems, especially anterior knee pain, the researchers now and the clinicians try to strengthen the VMO, and some of them have some good results. The exact determination of the idea of strengthening VMO in particular is not yet done in a correct manner. So we need some more researchers to arrive at the conclusion in that. So just remember that in medial patellofemoral pain or patellar pain, okay, for stabilization of the patella, and in conditions like anterior knee pain, you have a great role in strengthening the vastus medialis muscle. So most of them arrive at a conclusion that it is better to stabilize and strengthen your vastus medialis rather than focusing on isolated recruitment of any particular fibers. That's just an information for you. Yes, and now we go on to discuss much further into the quadriceps muscle. Yes, that is the second topic that we are going to discuss. That is the role of patella in quadriceps muscle. The role of patella in quadriceps muscle. Even though we have not discussed the patellofemoral joint, we are going to discover the role of patella in quadriceps muscle. role of patella in quadriceps muscle. Yes, quadriceps muscle function. See, patella has a very crucial role in the functioning of quadriceps muscle and vice versa too. Quadriceps has a great role in stabilization of the patella. You know that the patella is situated where exactly in front of the femoral sulcus, and the quadriceps tendon passes it and becomes the patellar tendon. And what happens is that patella has a great role in increasing the momentum of this muscle, increasing the momentum of quadriceps muscle. Yes? And secondly, it has a great role in increasing the angle of pull of quadriceps muscle. Angle of pull of quadriceps muscle. What happens if the momentum is increased? Any guess? The efficiency of the muscle increases. What happens if the angle of pull is increased? Definitely, again, the efficiency of the muscle is going to increase. So, the quadriceps muscle, momentum and the angle of pull of the quadriceps muscle is increased very greatly by the patella. And that is why we say patella act like an anatomical pulley. Anatomical pulley in the sense that it increases the momentum, deflects the muscle's action line and make it more efficient. Let us examine that in particular, right? But to note, patella is not a pure anatomical pulley because the force of contraction and the force of action that is above the patella and below remains completely different. Here you have a greater force and here the force is very different. If it is a true anatomical pulley, the force at both ends should be equal. But here the force is different here and different here. So we cannot tell patella as a true anatomical pulley, or patella do not behave as a true anatomical pulley. Now let us discover how this is going to increase the momentum. Right? Let us discover that. For example, let us draw a knee. Yes. And you have the tibia over here. And you have the patella over here. Right? This. Yes. And that knee is going for some degree of flexion. You have the same patella and everything over here. And the knee is going for complete flexion. You have something like this. Yes. Very good. Very good. And you have your patella over here. Right? Yes. Yes. And now let us see what happens here. And one more diagram we need that is going to help you a lot in understanding this action lines and this concept. This is an ideology where there is no patella, right? You see the quadriceps muscle is going to come and it's going to be attached like this. The joint axis is somewhat here. You see the momentum of this muscle. For example, you tell it 2 centimeter, but here you see the quadriceps muscle has to move past the patella, above the patella. Yes, this is how the quadriceps is going to attach. And you see the momentum from the joint axis, it's definitely greater. For example, 4 centimeter. So you can understand this scenario here. If patella is not here, the momentum of the quadriceps muscle could be very less, making it less efficient. So this is done. Yes. And now we have only 3 scenarios, which is complete extension. This is a slight degree of flexion. For example, you say 40 or 50 degree, and this is complete flexion. What is the difference? Let us see. Here you can see the patella, the quadriceps muscle is attached like this. Yes, very good. Yes. And here you can see this is what happens in a complete extension is that patella enters into the femoral sulcus, almost like this. Yes, yes. And you see what is going to happen? Yes. Now if we evaluate all of this figure, you see that at this particular point, the momentum is the maximum. That is, at this point, the patella is in this position, but at a 40 to 50 degree of flexion, patella is maximum away from your femoral condyles. And that makes the momentum the maximum at this point. Whereas in flexion, you see that patella enters into the femoral sulcus and it has a very little role. But here you will see that the momentum, even if the patella is in the femoral sulcus, the momentum is maintained to some degree, and the efficiency of the quadriceps muscle is exactly good at this point, because we are able to get up from flexion to extension. Why? That is because you see that the femoral condyles, which are shaped like this, convex condyles, is actually going to deflect the quadriceps muscle. If the femoral condyles was a straight line than this, we would have very less efficiency of the quadriceps muscle at the full flexion. But what happens? The femoral condyles are curved like this, and that curve makes the patella, the quadriceps muscle, to be deflected like this, and that increases the momentum. So, when a patient is getting up from flexion, the quadriceps muscle function or the momentum is a minimal value. When it increases from there to a degree of 40 to 50 degree, it is the maximum. That is because patella is from farthest away from that joint. And then it decreases again. It decreases as flexion increases and reaches extension. So the maximum torque generated by patella in quadriceps muscle is exactly at a 50 degree of flexion. And that you can see when you measure the knee range of motion, the maximum torque generated is at this 40 to 50 degree of knee flexion. Right? So this is the role of patella, in that it increases the momentum of muscle. And what happens in three scenarios, that is in full extension, half flexion, and full flexion. In full flexion, even though patella is in the condyle on the femoral sulcus, the condyles becomes, the role of the condyles, the femoral condyles, which are convex, increases in full flexion, and they deflect the quadriceps muscle tendon. So what happens? The momentum do not decrease much, and force generation capacity do not decrease. But this is seen now from here to here, there is a spontaneous increase in the momentum, and the patella is at the farthest position, and knee has maximum capability to produce extension at this particular point. Then from here to here, there is again decrease. That is up to knee full flexion, full extension, the momentum decreases and quadriceps muscle action decreases. Should decrease, but it is not decreasing. Why? Should decrease, but it is not decreasing. Why? That is because, exactly speaking, at this point you can see that the muscle is at its shortest position. Okay, but the quadriceps muscle is, even though it's at the shortest position, when the muscle is at the shortest position, it is capable to produce less force. You know that, yes. But the quadriceps muscle has a capability, or is being accelerated or assisted by this small momentum provided by the patella. That means, even though patella is providing a small momentum only in the terminal extension, that is in the last 15 degree, it is very valuable because of the shortest position of this muscle. So patella has a crucial role in providing knee extension stability or knee extension strength, even at full extension when the momentum is less. That is because at full extension, the muscle is in shortest position. Therefore, even though the smallest momentum can make a difference, can make a greater difference, right? Yes. So throughout the range of motion, patella has a crucial role in the activity of the quadriceps muscle, right? And the line of pull of this muscle, you know that at this position, this is the line of the pull, and at this position, this is the line of the pull, and at this position, this is the line of the pull of the muscle. And when line of the pull of the changes, it is in fact changing the activity of the quadriceps muscle. So what is the essence of this discussion? The essence of this discussion is that the quadriceps muscles efficiency is increased. It's a maximum at a 50 degree of knee flexion or flexion to extension because of the action of the patella, which is acting as a anatomical pulley. But still, at extension, the very slight contribution of the patella to the knee joint motion or the quadriceps motion is very, very crucial, because the muscle itself is at shortest position, and this slight activation or assistance by patella can make a huge difference. And now we move on to our third point of discussion, that is it advantageous? I want to just ask you, is it advantageous or is it not having any disadvantage? What am I talking about? The patella. The patella is increasing the quadriceps momentum in throughout the range of it is increasing from here to here, and it is decreasing, and finally it has a roll. Is it going to have some effect on the any other structures? Yes, of course. You know that the quadriceps pull, the quadriceps extension, when the knee joint is going for extension like this, okay, this can produce increased quadriceps activation, can produce an anterior shear in your which tibia, and anterior translation is prevented by your which ligament? The ACL. So when the quadriceps action is going to increase, it is going to adversely affect your ACL. That means it is going to stress your ACL. So when quadriceps activation increases, or when there is a greater momentum and greater line of pull which is increasing the quadriceps activation, the ACL is going to be strained. So there is a difference in ACL. So when knee extension increases, ACL torque increases, or the stress on the ACL increase. When the quadriceps action decreases, ACL effect also decreases. So this has a direct relationship between the activation of the ACL, the stress on the ACL and activation of the quadriceps. The more strength or more difference in the activation of the quadriceps, more is the anterior translation, and greater the ACL has to restrain that anterior translation. Okay, that you have to remember in your mind for training the ACL in injuries, ACL injuries. But you see that at 50 degree of knee flexion, or 50 to 60 degree of knee flexion, the ACL efficiency or the stress on the ACL is very minimal. Okay, at 60 degree of knee. That's just for a point to remember. So is it advantages or disadvantages? Yes, it is advantages, but it is going to increase the load on the ACL. So ACL strain or ACL stress on the ACL is going to increase. Yes. And now the next discussion, can the quadriceps contribute to the posture? Can quadriceps contribute to the posture? Yes. What is your idea? Do quadriceps muscle have to work? Does quadriceps muscle have to work when you are standing like this? Is my quads working? Or is my quads the most important thing that is working at this point? I will tell you no. Yes, no, because in this position of knee extension, the line of gravity is passing slightly, the line of gravity is passing slightly anterior to the knee joint. When it is passing slightly anterior to the knee joint, it is providing an external extension moment. And if gravity itself is providing extension moment, why should your quads work? It can take rest. Yes, that's the scenario here. When at full extension, the line of the gravity is passing, this is the line of the gravity, it is passing slightly anterior to the knee joint, and that can provide an external extension moment. And when this external extension moment is provided, the knee joint itself is capable of extending itself, and your quads can go for the rest. Therefore, quads activity is very minimal or comparatively smaller in knee extension. But what happens when a patient is going for, what happens, this is the scenario here, okay, the line of gravity passes anteriorly, but what happens if that patient is going for a knee flexion? Or what happens if that patient is going for a squatting? Or what if he has a knee joint contracture, knee flexion contracture? The line of the gravity begins to change and move to the posterior direction. Ultimately, when flexion increases much more, it passes very much posteriorly and will provide external flexion moment. External flexion moment. And this is the position where, the quads has to work. The quads has to work greatly to overcome this external flexion moment. So the activity of the quadriceps muscle is increasing when you go from extension to flexion. And your quads is responsible to holding you in that position due to its eccentric contraction. If there is a quads weakness, the buckling can happen. The knee joint cannot the knee cannot maintain or control the gravitational flexion moment and control the flexion that is happening. So the quads has to work continuously in an eccentric manner to regulate that flexion. If that is not there, the patient will fall down. He may not be able to stand in an extension position, right? That is the role of quadriceps with relate to the posture. In maintaining the upright straight posture, it has very minimal role, but from getting up from a seated position or going for a squatting position or in a patient with a knee flexion contracture, maintaining that posture, the quads has a greater role. And in this external extension moment at the extension position, okay, or not just due to that external extension moment, but due to the activity of your gluteus muscle and soleus, because you know that the soleus and gluteus, it's like this, okay. Soleus can, when it contract, it can pull your tibia posteriorly. So pulling your tibia posteriorly, I will explain this one. So let us imagine this one, okay, let it be the tibia. You have your soleus over here. When soleus is going to contract, this is actually going to, what do you call, this is actually going to pull your tibia posterior. When tibia is pulled posteriorly, knee joint is going for extension. At the same time, the quads, the gluteus maximus muscle, it has also a line of pull posteriorly, and that is also going to pull your femur posteriorly. So gluteus maximus and soleus muscle has a role in maintaining the knee extension or contributing to the less efficiency or less need of activation of quadriceps in extension, full knee extension. All right, yes. And then we move on to our last topic, that is the activation of quadriceps in weight bearing and non-weight bearing. See, now we have a scenario that is non-weight bearing. Non-weight bearing. See, a patient is sitting on a chair like this, and let it be his leg, thigh region, and this is be his leg. Okay, good, yes, okay. And now he has some weight cuff tied to the leg. For example, a 5 kg weight is tied to his leg. Okay, this is going to produce some force or a contraction or force. Now, if we evaluate the line of action of this force, or the momentum, we see that this momentum, let us examine that momentum in particular, okay? Yes, when we look at this momentum, we see that this is the joint line and this is the maximum momentum that this force is capable of generating. That is, for example, you say as a 1 centimeter, okay? Now the same patient is from the sitting position is exercising in such a way that he has extended his knee up to this degree with that same weight cuff, right? He has a weight cuff over here and he is extending his knee. Now see what happens. You are evaluating the momentum. We see that the momentum of this muscle, the momentum, this is the joint axis, is further away from the joint line. Is further away from the joint line. Yes, and finally, we have the last position, that is the patient went for the maximum extension. When the patient is at maximum extension, this is the same weight cuff over here. You see, evaluate the momentum, okay? You have a line over here. This is that, this would be the momentum of this muscle. So, the momentum of, you can imagine, remove that line. You can see that the momentum increases because this is the joint axis and this is the weight. The distance from joint axis to the load, that is the momentum. And here you see that the momentum increases. Here you see that the momentum is increasing, for example, 2 centimeter. This becomes 4 centimeter. What does this say? So in a weight bearing position, non-weight bearing position, that is a femur is or tibia is relatively free to move, there is an increase in the activation of the quadriceps, or there is a need to increase the activation of the quadriceps as the knee extension increase. So at this position or this position or this position, which should the quadriceps act more? at this position, because it has to, the momentum of this weight is increasing greatly, so that this quadriceps has to work against that. So the activation of the quadriceps will be greater at that point, right? So when in knee flexion to extension in non-weight bearing, there is a need of increased activity of quads. So quads has to go for an increased activity as the range increases. That is why the patient, even though you are tying a 4 kg or 2 kg, initially someone who has a weakness of the knee quads, okay, will be able to achieve a slight degree of knee extension in the quads table. Okay, but he may not be able to do the greatest, because when he is going to reach the full extreme, your quads has to work the maximum. So if he has a weakness of the quads, he may not be able to do it. Now the second scenario is a squatting scenario. For example, a person is standing like this. Okay. For example, when a person is standing like this, okay, right? When he is in this position, the extension, the gravitational extension moment is at the joint axis itself. So it is providing an extension. Now, what happens when that person is going for slight degree of what you call flexion? The gravitational extension moment goes back. And what happens if he is going for a complete squatting? Okay, when he is going for a complete squatting, the gravitational extension moment reaches the maximum. That means from this position to this position, that is from extension to flexion, in weight bearing position, the quads has to work. Here what was the scenario? From flexion to extension, quads has to work. But here from flexion to extension, instead of from flexion to extension, extension to flexion, the quads has to work. Here the quads activity is very minimal, because already the gravitational extension moment is providing that extension. But here this is slightly posterior, so your quads has to work. Here this is extremely posterior, so your quads has to work the greatest. So in weight bearing position, the activity of the quadriceps muscle is going to increase from extension to flexion, whereas in non-weight bearing position, the activity of the quadriceps muscle should be at its peak from flexion to extension, increases, right? And finally we have a scenario known as the quads lag. That's the last hint that we are going to discuss, and that is the inactivity or inability of the quadriceps muscle to provide terminal extension. This is seen in patients who has some patellar dislocation or patellar problem or patellectomy, or when the quadriceps muscle is weak. What happens? He is trying to attempt the SLR, okay, straight leg raise. At the terminal stage, he may not be able to extend his knee completely. That means the terminal extension will be absent. That is, last 15 degree of extension will be absent. That is because you know that in last 15 degree, the patella, even though it is having a less contribution to the momentum, it is having greater role because the muscle is such shortened position. But whereas in the flexed position, even if patella is absent, there is no problem in initial degrees, because you know that the condyles can do the role. But at the extremities, at the extreme range of full flex extension, the patella has a minimal role, but that is a significant role, and that has to have a play in providing the terminal extension. So in patients with the patellectomy or patellar, any dislocation or problems with the patella, and if there is a quadriceps muscle weakness, either of this condition can produce a condition known as quads lag, which is the last 15 degree of extension, right? Finally, we know before winding up, the pathomechanics, isolated weakness of any of these muscles are relatively unknown, right? Okay, most of them becomes weak as a group. But if any of this muscle is weak, what happens? Knee extension is decreased. But tightness, of course, rectus femoris can become isolatedly tighter. If rectus femoris is becoming isolatedly tighter, it can affect the knee joint and it can affect the hip joint, right? And other pathomechanics is the quads lag. Next one is that, for example, the quadriceps activity, we can minimize the quadriceps activity, or we can assist the elderly people in getting up from a chair. If you are adjusting the height of the chair, when you are getting up from a very small one, you need greater activation of your quadriceps. But if you are getting up from a height one, because of the principles we studied earlier, it is going to be very easy. So it is better to give elderly people a great height chair, so that their quadriceps activity is, even though the quads activity is minimized, they can get up from the table very easily, right? Then next one is the strengthening of the VMO, which is very particular in anterior knee pain or patellar problems. Right? With that, we wind up this discussion, and if you like the video, don't forget to click the like button and kindly subscribe to our channel.